How's it going, guys? So we have a very easy OBGYN question for 2CK. Not every question I make is going to be overly fancy or dramatic. Yes, some questions are going to be very simple, okay? But this is high yield, increases your score. So before we get started, I will be my frequent asshole, tell you to subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical, link is down below. Find me on Telegram, recently created a Telegram group and channel, links are down below. Now let's start the actual question here. So 29-year-old woman, 33 weeks gestation, she's had a seizure, blood pressure 165 on 90, deep tendon reflexes are brisk with clonus bilaterally, she has thrombocytopenia, elevated transaminases and serum LDH. Question wants to know what's most likely to be seen in this patient. So the diagnosis here is eclampsia. Okay, easy pass-level diagnosis, as I prefaced with, which for USMLE, you're going to learn that pre-eclampsia, it's hypertension after 20 weeks of pregnancy plus proteinuria. If you add a seizure on top of it, we now call it eclampsia. Now you say, but wait, there's no proteinuria here. As you learn on your OBGYN rotation, preeclampsia/eclampsia is actually more complicated than just hypertension and proteinuria. You can get neurologic findings, like even without the seizure that makes this eclampsia, this patient has upper motor neuron findings, brisk tendon reflexes and clonus. These are UMN findings. Okay, that's severe preeclampsia if we didn't have the seizure here. And you can also get renal pathology, hepatic pathology with elevated transaminases. Okay, you can get thrombocytopenia, you can get hemolysis. All right, so the definition of preeclampsia/eclampsia is not just proteinuria and hypertension plus or minus seizure. You need to know that. Now, this patient has what's called HELLP syndrome, HELLP syndrome. Hemolysis, elevated liver enzymes, low platelet count. Serum LDH and USMLE means hemolysis. RBCs contain high amounts of this enzyme. And if you see lab values where LDH is high, you're like, what the fuck does that mean? It can reflect intravascular hemolysis, which this patient has. Thrombocytopenia and elevated liver enzymes. Okay, HELLP syndrome. So we are going to look at the answers here, say what are we most likely to see. Choice A, deficiency of ADAM TS13, wrong fucking answer. This is the correct answer for thrombotic thrombocytopenic purpura, TTP. This is a matrix metalloproteinase that breaks down von Willebrand factor multimers, okay, cleaves von Willebrand factor multimers. This is going to present as a pentad of renal insufficiency, neurologic signs, fever, schistocytosis, thrombocytopenia. Wrong fucking answer in this case. Choice B, deficiency of G6PD, you instantly know is the wrong answer because it's X-linked recessive. We have a female here, okay? Some students will get overly pedantic and read between the lines and say, OMG, could we have skewed X inactivation? Wrong fucking line of thinking, okay? This is going to be a boy who's had a recent viral infection or received a drug and now is a bit jaundiced, has yellow eyes, increased unconjugated bilirubin, bite cells, Heinz bodies, those types of things. So G6PD deficiency, wrong fucking answer. Choice C, hyperkalemia, wrong answer. Just general distractor, no reason to think this whatsoever. We could speculate the notion as far as if a patient had renal insufficiency. As I said, you could get renal issues with eclampsia/preeclampsia in theory, that potassium would go up in renal insufficiency, but distractor here, no real relation. Choice D, myoglobinuria, wrong fucking answer. This would be expected for rhabdomyolysis, okay? I mean, there's no reason to suspect that either. If we had an alcoholic, that increases the risk for myoglobinuria/rhabdo. I mean, statin use, electrical burns, long/strenuous exercise like marathon running, McArdle syndrome, glycogen storage disease type 5. I mean, we're really stretching the fucking envelope right now, okay? Wrong fucking answer. So our correct answer is schistocytes. USMLE expects you to know when you see these fragmented RBCs, which HELLP syndrome is one of them, okay, as well as HUS and TTP, hemolytic uremic syndrome, as well as deficiency of ADAM TS13 or antibodies against, and mechanical valves, okay, can cause shearing of RBCs. Now, this is a lengthy fucking discussion, okay? We could make the clip 7 minutes longer about OMG, the mechanisms of how we form different types of RBCs, but I want to stay concise here. So your take home is that this is eclampsia, and in both preeclampsia as well as eclampsia, you get schistocytes. It's that simple, okay? It's just a factoid you need to know. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.